Thank you, Mr. Chairman. I want to thank each of the witnesses. You've given really such important testimony. And to all of the advocates in the hearing, in our hearing room today, you need to know that you are the oxygen of all of these efforts. Before I came to Congress, I thought that Congress was a proactive institution. And I don't know what got into me, but I got here and quickly realized it's a reactive institution, reacts to the voices of people from across the country. So when I say that you are the oxygen of all of these efforts, you move the needle every day, every month, every year in all of these efforts. And we're all really very, very grateful to you. And I'm always mindful that legislation doesn't move without you. So bravo to each one of you. Mr. Feist, it's great to see you again. You were here in 2021. You described that your late sister-in-law, Dr. Lorna Breen, was afraid because she was convinced she'd lose her medical license if she asked for help, a fear that ultimately contributed to her death. Your testimony, really outlined where we are in the country today. We have 6,120 hospitals in the country, but only like 1%, the needle is moved, like 1%. I'm grateful for the 1%, but at this rate, the issue is not going to be addressed. I don't know the following, and I'd like to ask you if you do. Do hospitals cover their doctors' insurance, or is it up to the doctors to determine on their own what they buy?
Which type of insurance are you speaking of?
Well, health insurance.
Their health insurance. Okay, I didn't know if you meant malpractice insurance.
No.
So lots of insurance out there. So first of all,
That's a whole nother issue.
it is. By the way, I have Jennifer here, Lorna's little sister. My wife is also here today with me. I didn't acknowledge her in my remarks, but she's here.
Well, thank you for
Valentine's Day,
being
honey.
here. Thank you.
Thank you so much for asking that. It's really interesting. So the insurance that is covered by physicians, if they are or for their care, personal care, is their employer. So if they're employed by a hospital system, which a huge section of our physicians in this country are,
That's why I'm asking the question.
then yes, they do not have a choice. They are given the insurance. You're probably getting at what their network of providers are.
Well, I'd like to know if in fact the hospitals, the doctors are insured through their employer, the hospital. Is mental health coverage part of it?
It is, and importantly, what we...
I don't know how far we get with administrative issues. I think that their insurance policy should cover mental health issues, and that it be private and not subject to the general gossip of the hospital that Dr. Smith is receiving mental health counseling.
That's exactly right. So what you're getting at is actually where they need to get care. Now, their employer defines who provides them the care. And in most cases, if you're a hospital system providing insurance to your employees, you tend to not want to broaden the network of options because you're kind of paying your competitor to take care of your employees, if you will. In the mental health space, what you're speaking to is exactly what we need to do. We need to broaden the networks to make sure that physicians can seek care outside of the hospital.
Let me ask you this. Don't you think in a reauthorization that this issue needs to be addressed?
Yes. So I mean, if I may, just for a second, what you're talking about is allowing the networks for the physicians to be able to access outside of their institutions because of their concern around confidentiality. And that is
I think if it's confidential, it really doesn't matter whether it's inside the institution they're working at or outside? Or do you think I'm wrong on that?
If you speak to the widow of Scott Jolly from Utah, his only network option was in his hospital system, and he was so burdened by the stigma of being treated by his colleagues, he died by suicide.
Well, my time has expired.
you.
Thank you to each one of you.